what I want to look at is signs that your pet is declining. So, whether your pet is suffering with a genetic disease, an infectious disease, a cancer, or being ancient, we want to talk about how do you know that things are starting to decline. This is our hospice and palliative care week. So, we are going to continue mostly focusing on seniors. And I do know that you could have a young pet with cancer that is in hospice or palliative care. Certainly, we see a lot of lymphoma in very young cats, 3 and 4 year old cats. We see, particularly Bernese Mountain Dogs, very early with histiocytosis and some weird cancers. So you could have a young animal, but I'm going to focus right now on and actually what I'm going to talk about signs that your pet is declining. And so these you could see these signs in a younger animal who, for instance, a cat with feline leukemia, cat with feline AIDS, the FIV. Um, so if your animal is suffering with a chronic disease, I have quite a few clients right now who have dogs with polycystic kidney disease. So that would be a young dog with a genetic problem who may be very young, but in hospice or palliative care already. So what I want to look at is signs that your pet is declining. So, whether your pet is suffering with a genetic disease, an infectious disease, a cancer, or being ancient, we want to talk about how do you know that things are starting to decline. And I loved, if you didn't see my interview yesterday with Monica Turen, please go back and watch that. She talked about looking for things in a different manner than the things that we normally talk about, like loss of appetite and that sort of thing. And it's really looking for the subtle clues that your pet is giving you that things are not what they used to be. And maybe things are starting to shut down a little bit, or things are changing in ways that you need to either address them to improve that parameter, or you need to look at it and say, oh dear, maybe I can't fix that parameter. But there are so many things that we can be doing. All right. So one of the first signs that things may not be going as well as they used to is sleeping more than usual. And there could be so many reasons why your pet is sleeping more than usual. Now, it could be they're just really lazy and you're not stimulating them to get up and do anything. So my Gabby, who is probably 7, she's really lazy. She's not a big fan of going out and running around the yard. Like George loves to go out. My 15-year-old loves to go out and trot around the yard. He races through the house. Charlie, we don't know how old he is, even though he's blind. He trots around the yard. He loves to play fetch in the house. Forrest is a ball of energy. But if you have an animal who used to be active and they're sleeping a lot more, there can be a lot of reasons behind that. They might be in pain. So my Doberman, trying to remember if it was my first one or my second one. It's my second one. He was 9 years old and he slept a lot. And I just thought, oh, he's getting older. I guess he sleeps a lot. And that was right when Rimadyl came out. I was not holistic yet, and it was touted as the wonder drug that was going to get all of our animals moving again, all of our dogs. And so I put him on Rimadyl, which I never should have done because he had high liver enzymes. He had chronic active hepatitis. This is probably the worst thing in the world that I ever could have given him. However, after a couple of days on Rimadyl, the dog was racing around our 3 acres, chasing the deer, jumping over the back of the sofa. And so I did not realize that my dog was sleeping all the time because he was in pain. Animals don't necessarily vocalize that they're in pain. They don't necessarily limp but they can have a lot of pain. cats are incredibly good at hiding their pain. So if they're sleeping more than usual, you might want to get some x-rays done and see, do we have a lot of arthritis going on here? Is it, is there something that I should be doing? And now we do have a blog, Natural Treatment for Arthritis. So there are so many things that you can do. Like if I had that dog now, I would do everything so differently with him. They also might be sleeping more because they've got cognitive dysfunction. Maybe they're not realizing that it's daytime and they should be up moving around. We do with cognitive dysfunction, they can mix up their days and nights just like people can with sundowner syndrome. So some of these animals that used to sleep all night are now wandering around at night. Sleeping can come about for a lot of reasons. If they've lost their vision or their hearing, now that's really not something that requires hospice or palliative care. Being deaf or being blind is not a life-threatening issue, except for the fact that they can't hear traffic or see traffic. So it is up to us to keep them safe. But they may be sleeping more because they can't see as well, or they can't hear as well. So they don't interact with their environment because they don't know that things are going on around them. Another thing that, oh, here she comes. Hi. Are you exercising by trotting across the room just because I said you don't exercise? Hmm. Yeah. So the second thing that we might see that is an indication that things are going south is urinary accidents or loss of house training or incontinence. So maybe all of a sudden your cat that used to use the litter box or your dog that used to find the door and go outside with no problem is suddenly urinating or defecating in strange places, or maybe getting to the door but kind of forgetting how to ask to go out. Um, Urinary leakage could be a sign of something else going on. So, with cancers, a lot of times we have increased thirst and urination and decreased ability to hold the urine. We'll see it with Cushing's disease, we'll see it with kidney disease. So, the first thing, if they are having urinary or bowel accidents, we'll see it with arthritis, particularly kitty cats who can't. Climb to get in the box anymore. They may be urinating next to the box or outside the box or on a flat surface somewhere because they can't climb into that box anymore. Um, so when we see things like this starting to happen, that urinary leakage or accidents in weird places, then that could be a sign that something is going south. And certainly with these older animals or animals with heart disease, some respiratory issues, if they're put on a diuretic or if they have any reason to be drinking and urinating more than usual, then this can be something that we start to see that's an indicator that maybe we better up our game a little bit for what needs to be done for these guys. Older pets or pets who are less active are going to be prone to urinary tract infections. So if they've got arthritis that's making them not want to get up and go out as often, or not climb in the litter box as often, if they are just painful and don't want to get up and go to the door, or they forget, they're definitely going to be more prone to urinary tract infections. And then urinary tract infections can secondarily cause leakage, incontinence, those sorts of things. So if it's something new, I definitely would recommend at least checking a urine sample, maybe getting a culture done, see if there's some reason why they're having this issue, because you want to know, are the kidneys starting to fail? What is at the underlying cause for why we're suddenly leaking? And certainly we spent our week last month on talking about the right timing for spay and neuter, and certainly early spay and neuter and decreased hormonal input. We know that leads to incontinence down the line and urinary leakage. So that could be part of what's going on as well. Decreased mobility. So a lot of these animals, when they're older, are not able to get up on their own. They can't walk on our slippery floors. So part of palliative care is making sure that they have the tools that they need to get up and get going, whether that's slings or nail caps or grippies on their paws or a cart like my little Charlie here. So decreased mobility can be caused by a lot of things. A lot of times, again, pain, arthritis, frozen joints that just don't work as well. But we also see it with muscle wasting. Cushing's disease is a good example of muscle wasting, but in Chinese medicine, we're going to talk about this on Friday. We see something called Wei syndrome, which they're literally their muscles are just wasting away, and they don't have that muscle strength, and that's where physical therapy, helping them, supporting them, slings, walkers, carts, whatever it takes to get these guys moving, and certainly doing like passive range of motion. You definitely should work with your veterinarian or a physical therapist to find out what exercises you can do for your pet that would be appropriate and not cause any pain for them. But for palliative and hospice care, we don't want to have these animals just lying around, not ever being moved. And if they are immobile, pressure sores can be a huge issue. If they have muscle wasting, they don't have any padding over their bony points, then they're much more likely to get pressure sores. So if you have an animal who is down, it is really critical that you understand how to care for them so that we don't end up with deep-seated infections. That is actually what brought about me euthanizing Scout when he was 18. He had complete muscle wasting. He had a lot of cognitive dysfunction, and he kept falling down a lot. And he actually developed a pressure sore over his right hip that was so deep and so painful that there was nothing that we could do to manage it at that point. So sometimes something that seems like it should be a nothing, like a pressure sore, can be enough to bring about the need to do something that you don't really want to do. So really critical to keep these guys moving and keep that muscle built as well as possible. Inability to respond to simple commands. Now, it could be that they just don't have an interest. It could be that they can't hear. It could be that they have so much cognitive dysfunction or decline that they don't remember their commands, or it's getting scrambled going in one side and out the other. So it could be that they can't hear you, they can't see you. And certainly we are seeing more and more and more brain tumors in our pets. Not too many people go ahead and get an MRI or a CT, but we are getting that diagnosis quite commonly now, unfortunately. Other things that you might see: increased anxiety, panting, or shaking. So as animals are declining, a lot of time cats don't pant very often. So if you are seeing your cat panting, that is a bad sign. So I would be looking for heart problems, respiratory problems. What's causing that kitty cat to do that. Cat only being able to get up a couple of steps before they have to stop and rest and pant, and so that would be really significant. But animals will pant from pain. They can pant from metabolic disorders like Cushing's disease. Definitely is a huge cause of panting because they have so much heat in the body. But cancer is a hot disease, and some of the kidney diseases are hot diseases. Diabetes, anything that's an inflammatory disease, increases the heat in the body. So we get increased panting, and sometimes we'll get whining and shaking. I get a lot of emails from people with my dog now has tremors. We sort of jokingly say that our little Georgie has doggy Parkinson's, because sometimes he'll just be standing there and his legs, all four of them, are just shaking while he's standing. And that is a chi deficiency. We also can have animals that are hiding or acting more nervous or scared, where they used to be outgoing, interactive, and they're suddenly becoming a little more withdrawn or fearful. Part of that could be decreased vision, could be decreased hearing, decreased ability to process what's going through their brain. But they also, can be shaking and whining because there's pain somewhere. So whether that is, a tumor that we haven't found internally, or arthritis pain, GI pain. So anytime you've got the whining or moaning, most animals do not whine and moan. So if you're getting that, definitely do some investigating to see what's going on and see what you can do and make sure that you are managing pain for these guys. Decreased interest in surroundings. So they just don't really want to interact anymore. You walk in the room and they're like, "Meh." It's kind of like Monica was talking about yesterday with the dog, the golden retriever, that couldn't get up anymore. But that dog still had a huge interest in chasing the ball, just couldn't chase the ball. So they found a way around that. But if you have a an animal who was always interactive and suddenly they are not interactive, and like if that golden retriever, you brought that ball and the dog was like, I don't care, that would be a problem. So that was something that that owner could use in their little journal to say, yeah, our interest in the ball today was a 10. Oh, our interest in the ball today was a 0. Crap, what's going on? What changed? So those are the kinds of things that we can be looking for. And sometimes decreased interest in surroundings is that you're just not giving them any mental stimulation or any reason to have any interest in anything. Like I said, Gabby, she would lay in the recliner in the corner of my office all day and never move if I let her. Some days I do because I'm really busy, but it's much better for her if, well, it's better for both of us if I get her out of the chair, take her outside, take her for a walk. She won't chase a toy, but I can take her out for a walk, take her down to the barn, do something that is mentally stimulating and also moving the muscles and increasing strength. So, really critical. And so, if they're not interested in their surroundings, try to figure out why. Are they painful? So they're being withdrawn. Are they afraid? So they're being withdrawn because they don't hear and see as well. Um, are they just confused? Or are they really at that point where they're shutting down? Because that is one of the things that we will see as we're getting closer and closer to the end. These are all things that we'll see. A lot of times they're shut down. They don't want to interact with their surroundings. They're not interested in their food. And they don't want to interact. Um, Other things that we'll see is getting lost or stuck in corners. Again, so many things could cause this, but it could be, again, decreased hearing and vision, cognitive dysfunction. I can't tell you how often Charlie, our blind dog, gets stuck in corners. Now, he's only been in our house for about a month, so he's still learning where everything is. But there are times when he walks straight into a corner and just stands there and is staring into the corner. And I'm like, okay, you don't know where you are and you don't know how to get out of there. And we see that a lot in our senior pets. And this can happen even with cats. So if a cat suddenly loses their vision, they will get stuck in corners. And if they can't hear, like if they're losing some of their senses, they will definitely get stuck. Cats tend to get more withdrawn. But if they suddenly lose their vision, like with a retinal detachment from high blood pressure or something like that, they'll be really freaked out. And so they will vocalize a lot and they'll walk. So when we get them in the vet clinic and put them on the floor in the exam room, they'll walk and they'll find a wall and then they'll track around the room along the wall because they're feeling with their whiskers or their ears or whatever they've got close to the wall, and they'll vocalize. So that's, if you're seeing that suddenly in your cat, cats are not great about vocalizing with pain unless they're really in pain. And then decreased purposeful activity. I'm just gonna lay here and do nothing unless you really give me something I have to do. If you have a dog who has always gone ballistic when the mailman comes and now they're like, I don't care. That's a problem. That is a problem. I think that writing down and assigning a number 1 to 5 or 1 to 10 for different things for your animal. And so most traditional veterinarians will include things like appetite, mobility, pain score, drinking, interactions. So those are kind of the more traditional things. But from a more holistic standpoint, we are going to track things a little bit differently. So look at changes in how they sleep. Do they sleep curled up in a tight ball? Are they sleeping sprawled out? Have they changed where they sleep? the position they're sleeping in, look for the panting, look for the water drinking, monitor gum color and tongue color, and just notice, are there changes? You may not know what those changes signify, but if you're looking at his tongue and it's this bright red one day and then the next day it's purple, that's a change. And so just noticing things like that can be really critical. And then noticing their interest in their surroundings, in their interactions with housemates, in their interactions with humans in the house, in their interactions when people come to the house, anything that changes. So at our house, we have a driveway buzzer bell thing, and it goes off twice as people come up our driveway. Um, Forrest goes nuts. If Forrest ever did not notice the driveway bell, I'd wonder what was wrong with Forrest. I don't think Gabby cares. Charlie perks his ears up. George doesn't hear it, but I know that's normal for George. So just make notes of symptoms that your pet is showing and changes as they're occurring. Give them a score. You can make a spreadsheet if you want to. If you're a metal personality, go right ahead and do that. Our course does a deep dive, and we did look it up. It's over 15 hours of study time. So I can't do that in a Facebook, YouTube, Instagram live. I can't cover all that. All right. Everybody have a wonderful day. Hopefully everyone will stay safe with the winter storm that's coming. We're just going to have some rain.